Today we are going to speak on reproductive technologies in goats. Small ruminants are seasonally polystress breeders. However, under tropical conditions, the reproductive activity of goats is unaffected due to the seasonal variation. Uh, the standard data is that those will exhibit estrus cycles every 20 to 21 days. There are four reported technologies I have enlisted here. However, the first three ones are more common for field application. First is estrus synchronization. Second one is artificial insemination. And third one is ultrasound. Fourth one, though, is available, embryo transfer, IVM, IVF. Basically, for field use, it has a still not practical to use it on the field level, though it is okay for the research work and good institutes. So let's start with the estrus synchronization. Now, what are the different protocols are available in goats for estrus synchronization? The choice of protocol depends on whether is the particular goat, female goat is cyclical or non-cyclical. What is the material available and cost of material used? I think this is very important for goat sector, mainly because everything may not be available at the field level. Also, the cost of material used for synchronization protocol, like various hormones, implants, the costing does matter in sense that if the cost is too high, the end user may not be interested in taking these facilities because the goat industry is still in an evolving stage. So just to briefly talk about the simple estrus cycle, the stages of estrus cycle are proestrus, estrus, diestrus, and then again the metestrus, diestrus, and then again the proestrus. So proestrus is for 2 to 3 days, estrus is for 24 to 48 hours. Then the pregnancy, in case there is artificial insemination and conception, the pregnancy will continue for 145 to 153 days. If animal does not conceive, from metestrus, it goes to diestrus, and from diestrus, it again goes back to proestrus. This is what is the cycle, estrus cycle in the goat. Now, when you talk about estrus synchronization, there is possibility of various methods. One simple method is exposure to male. So this is male effect, the buck effect. What is done is you keep the buck away and keep the female goat flock separately. Now these females are exposed to male after gap of 14 to 21 days, and then allow the male buck to mix with this particular flock, and naturally there will be some amount of synchronization. This is one of the simplest method possible. However, there are other methods of like hormonal protocols which are more commonly used. Now, various hormones which are related to reproduction, I'll just try to enlist as a revision. Estrogen is secreted by dominant follicle, which induces the behavioral estrus. Progesterone is secreted by corpus luteum, which helps into maintenance of pregnancy and suppresses the ovulation and next estrus cycle. Prostaglandins are secreted by endometrium of uterus and they regress the corpus luteum. And then there is GnRH, which is secreted by hypothalamus, which indirectly stimulates the follicular growth as well as stimulate the ovulation through FSH and LH, which is from anterior pituitary. So how these hormones work when we talk about synchronization? First is most commonly used is prostaglandin. Now these prostaglandins naturally are secreted by endometrium of uterus and they cause corpus luteum lysis. Once the corpus luteum luteolysis happens, it removes the progesterone block stimulates the follicular growth. The dominant follicle will grow. There will be rise in estrogen. Estrus will be exhibited. Rise in estrogen will induce the LH surge, and LH surge will result into ovulation. However, when we are using PGs for synchronization, they don't work when the corpus luteum is fresh, that is from day 4 to 6 after ovulation. So you have to use these PGs after day 6 of ovulation. There are two types of PGs available. One is synthetic and one is natural. Now the synthetic analogs, they usually have more rapid effect than the natural PGF, which has a more slow effect in luteolysis. So dinoprost is available. It is used intramuscularly, 2.5 to 5 milligram. And cloprostinol, which is commonly used, which is a trade name Estrumed, is a derivative of or a synthetic analog of a prostaglandin, which is used at the dose rate of 125 microgram intramuscularly. So these are the more commonly, both are used for estrus synchronization, that is prostaglandin. Then estradiol benzoate is also used. It is used in a synchromate B protocol. The advantage of estradiol benzoate, it helps into regression of corpus luteum, which is early, that is 1 to 5 days old in ruminants, which is non-responsive to PGF2 alpha. Then ECG or equine chorionic gonadotropin, ECG, which is also known as PMHG, is also used as a part of synchronization protocol to stimulate the follicular growth. ECG has action more like FSH and less like LH. So the FSH action part of the ECG helps into stimulation of follicular growth, and therefore again the release of estrogen, estrus, and ovulation. The LH part of the PMHG, LH-like part of the PMHG helps into ovulation and formation of the corpus luteum. Progesterone and its derivative are also used as a protocol in a protocol of synchronization. Their action is they are available as injectable, as oral preparation, oral feeding, or vaginal implants. However, vaginal implants are more common in case of goats. The main function of these external progesterone derivatives is they mimic the corpus luteum and maintain the progesterone level during and mimic the corpus luteum. So unless and until you remove the source of this progesterone in form of either implant or the oral feeding, animal will not exhibit estrus till they are not removed. Now, GnRH is also used in some protocols. The GnRH stimulates both LH and FSH from anterior pituitary. FSH part again takes care of the follicular growth, its maturation, estrogen production, and LH part takes into ovulation and further CL formation. So these are the various hormones which are regularly used for estrus synchronization. I have just put a slide to show what are the available things. You can see here, this is the progesterone implant. This is available. These are the sponges with the progesterone. These are the lutalized instrument. These are the injections. Then this is polygon, that is PMHG. So these are the various products which are available for the use in goats for estrus synchronization. Now, estrus synchronization, the basic principle of estrus synchronization is either shorten the life of corpus luteum or increase the life of corpus luteum. However, when you are talking about shortening the life of corpus luteum, the animal has to be in cycle. So the prostaglandins are used only when the animal is cyclical and a functional corpus luteum is present. So when the functional corpus luteum is present, You can use the protocol of prostaglandin 11 to 13 days apart. Once the second dose is given, the estrus identification is done, and breeding can be done by AMPM rule, or you can do artificial insemination. Now, you cannot use prostaglandins when the animal is not cyclical and does not have a corpus luteum. Now, there is a question, why not use single prostaglandin when it is responsive corpus luteum is there. So remember the once I before in few slides before I said the prostaglandin doesn't work when the corpus luteum is up to first 4 to 6 days of after ovulation. So when we are talking about synchronizing a large flock, they can be in various stages of corpus luteum formation. Some will be of day 2, some will be of day 6, some will be of 8, some will be of 10. So when we are talking of synchronizing all of them, the first injection can induce estrus in animals, in female goats who are indoors, who are having a corpus luteum which is more than 6 days old. However, those who are having corpus luteum which is less than 6 days old will not respond to first injection. So when you give the second injection, 11 to 13 days apart, they will all will be showing the estrus at the same time, or estrus synchronization will be seen in entire flock. However, you can use single injection. But whichever animals come in estrus, they can be inseminated or given a natural service. And then remaining animals, you can give the second injection. That is also possible. Prostaglandins can be used in combination with GnRH also. There are so many protocols available with various combinations that I have tried to enlist many. So, you have to use what is the best you can find on your level. So PGF12 on day 0, then GnRH agonist 7 days later, which will induce the ovulation of the follicle, which is dominant there, will have a corpus luteum formation. So again, 7 days after you give the PGF2 alpha, that is day 14. So the dose which are not having the corpus luteum when the first injection was given will have a corpus luteum again because of the GnRH agonist that was given on day 7. And then again do the GnRH with a fixed time AI 72 hours later on day 17. So this type of protocol is used for fixed time artificial insemination with TGF2 alpha with GnRH. Now progesterone can be used in those who do not have a functional corpus luteum. As I said, PGF2 alpha is used only when there is a functional corpus luteum. So vaginal sponges or control internal drug release devices, CIDR, are more commonly used. There are two types of protocols that are involved. One is short day protocol, where the implant is vaginal sponge is given only for 5 to 7 days. A dose of PGF2 alpha is recommended by initiating a short protocol, that is at the time of insertion, to ensure that no corpus luteum is present when you remove the implant. So when you remove the implant, there should not be any corpus luteum. In long-term protocols, long day protocols, which is used for 14 to 21 days, PGF2 alpha is administered 24 to 48 hours before CIDR removal to ensure that there is no corpus luteum present when you remove the implant, or you can completely omit, but the corpus luteum lifespan has to be exceeded at the time of removal. So a long day protocol, if you don't want to give PGF2 alpha, extend the days of implant. You can make it more around day 20 to 21, so that if there was any corpus luteum present, that will be also regressed by the time you remove the implant. However, There are some references which say decreased period of progesterone treatment may minimize the vaginal discharge and infection, because when you put these implants for longer duration, we had this problem. We had kept the implant for 14 days, and while removal, we had to wash the vagina with normal saline. So because so much vaginal discharge was accumulated. So to avoid this vaginal discharge accumulation and possibility of infection, short day protocols are preferred by some people. After removal of the progesterone implants, those usually will exhibit the estrus within 48 hours, and either natural service or insemination can be carried out. So combination protocols use various combination with progesterone, prostaglandin with GnRH. Now, whenever you are using a progesterone protocol, the either administration of GnRH agonist or FSH or PMHG has shown beneficial effect along with the progesterone. So I have just enlisted many 3-4 protocols here. There are actually many more protocols available. GnRH at the time of CIDR insertion is given. CIDR is put for 7 days, and PGF2 alpha is given 1 day before or at the time of removal of CIDR, and estrus response is shown within 48 to 96 hours. ECG or PMSG can be given at unit 100 to 500 international units at the end of treatment to increase the synchronization ovulation rate. Then implant can be used for 11 days with PMSG and PGF2 alpha administration on day 9 and fixed time AI on day 12 and 13. Then there is another protocol which uses PGF vaginal implants for long duration, that is 18 to 21 days, and ECG 400 international units on day of implant removal and insemination at 30 to 48 hours. However, we have commonly used the protocol with vaginal sponges for 12 days and 100 international unit PMSG on day of removal and AI, that is day 12, end of day 12, and on AI on day 14. And we have got best results on this protocol. And I think for quite some time, for 3-4, we have repeated this protocol 3-4 times and have a very good results with this, around 60 to 70% conception rate. So there are disadvantages of using ECG. However, whenever we have used GnRH, ECG, and we have always got best results with ECG. However, there are certain problems with ECG. We have tried to use a lower dose of ECG, 100 international units, because high dosages of PMSG are characterized by superovulation, low fertility, shortened estrus cycles, sometimes pregnancy losses, and problems during parturition because of multiple kids. Then the repetitive use of PMSG can produce antibodies against ECG, and that will result in modification in the time of ovulation and consequent reduction in fertility when artificial insemination used at fixed time. So these are some side effects of ECG. However, when we have used it at 100 international units, we have got very good results. So these are another few protocols which I am sharing. I'll just go through. There are n number of protocols available. This is another protocol which is available. All are using mainly medroxyprogesterone acetate implants along with estrus detection and artificial insemination. Even this is one with a intravaginal sponge with PGF2 alpha and PMSG. One is with GnRH, PGF, GnRH. So there are multiple permutations and combinations are available. when you talk about estrus synchronization, but I have shared the one where we got the best results. So these are the intravaginal sponges removed. Melatonin has also been shown to have an effect. I do not have any personal experience in melatonin usage to induce the synchronization. Melatonin is secreted by pineal gland during periods of decreasing day length in case of goats, which helps them to bring it the goat in the season. So decreasing exposure to artificial light indoors will uh, enhance the secretion of melatonin and they will start cycling. So melatonin implants 18 milligram have shown to induce fertile estrus 50 to 70 days after implant insertion. And people have used these melatonin implants along with estrus synchronization protocols at the end of implant action. So I do not have any personal experience with melatonin usage. Now, next topic which I have taken is artificial insemination. Now, artificial insemination can be done by using fresh semen that is used in few hours after collection and dilution. Then you can use chilled semen, which can be stored under refrigeration temperature for 48 to 72 hours, or frozen semen in liquid nitrogen, which is stored for years together. So factors which are affect the optimum conception rate when you're using AI is first important is viable semen. So source of semen should be from a good source where if you are using frozen semen, it should be used you should be collecting the semen from the source which is reputable, where the liquid nitrogen has been maintained at a proper level throughout the preservation and storage, because it is known that maximum failures in artificial insemination are due to improper handling of frozen semen. The post-thaw mortality is very poor when the frozen semen is not handled during storage properly. The next factor that affects the conception rate when you're using AI is appropriate timing. Uh, so right time of AI is most important along with viable semen. If those are inseminated too early before ovulation or too late after ovulation, they will result into low conception rate. So for this, proper heat detection is required. Of course, there are certain protocols which use fixed time artificial insemination where you do not depend on heat detection. However, when you are using the heat detection for artificial insemination, the right proper heat detection becomes most important. Then third factor which affects is proper site of deposition of semen. So the semen has to be deposited in the cervix as deep as possible. And if you deposit the semen in anterior vagina, that will reduce the conception rate. See, in goats, in large animals, we are able to fix the cervix by parectally holding the cervix and then passing the milk. However, in dog, when you are fixing the cervix, you are using the speculum to fix the cervix. So the right technique is very important when you're fixing the cervix and passing the gun or your catheter in the cervix for deposition of semen sample. Of course, it goes without say that the dose also for receiving the semen sample have to be in good health. They should have a good BCS, body condition score around 3. They should be disease free. That goes without saying. So advantages of AI, I will not talk too much about this because everybody knows that. But especially in goats, I would like to say that it eliminates the cost of keeping a goat buck in a flock. So the nuisance of buck, the maintenance of buck, especially unknown matings, because when the buck is free in the flock, The matings will be unknown matings. You will not know exactly when the doe is naturally served. So naturally, how many are pregnant, how many are non-pregnant, there is no data. So if there is no data available, naturally, you can't plan your future, when the kidding will happen. Uh, so whole economics does go haywire. So if you couple, so the artificial insemination helps you in keeping the good records and then forming the future, how you can even enhance your flock in genetically also. That artificial insemination is integral part of it. And when you couple it with synchronization, there has to be artificial insemination, because if you bring in too many animals, too many does in estrus at one time, single, even if you have few male bucks, uh, natural service will not be sufficient. So you will be able to use, you should be using artificial insemination when you synchronize the animal, so that you can plan your crop at the time of when the meat demand is high. So depending on the festival seasons, when meat demand is high, you can synchronize your animals, plan them synchronization accordingly, backdate it, and use artificial insemination. So this gives advantage in goat industry for artificial insemination. What are the disadvantages? Main disadvantage is availability of trained people and equipment. However, the this can be eliminated by increasing awareness and increasing training, giving training to people. The cost of the material which is used for artificial insemination, if it is not well executed, that is correct, not correctly timed, semen quality is bad, wrong technique, will result into low pregnancy rate compared to natural mating. So naturally, the people will stop using the artificial insemination. So well execution is the must for if you want to promote artificial insemination at the field level. So I've just put in few slides of how the artificial insemination procedure. This is at our farm, the collection of semen. The semen is collected. You can see in the next slide, the semen collected in artificial vagina. Then this is a dilution of semen. Now, the semen which is diluted by using tris diluter, where egg yolk percentage is 5 to 7 about, you can either keep it under refrigeration temperature for, or you can use it fresh immediately after dilution, inseminate the animals, or you can keep it under refrigeration temperature for 2 to 3 days. And in next 2 to 3 days, you can continue using it, or you can freeze it in French straws, which I have shown in the next slide. There you can add, you need to add glycerol while doing the preservation at 7 to 8%, and then uh, keep them in liquid nitrogen and preserve them in liquid nitrogen. So these are the vaginal sponges which we use for synchronization. This is an applicator, a plastic applicator, through which the vaginal sponge is introduced inside. Then there is heat detection. This is a male goat with a apron in the front of penis for estrus detection. There is a release in the flock, and then the artificial insemination is done. Now, at the best time to inseminate is 12 to 15 hours after the start of heat. However, recently I spoke to Dr. Gharsasi, and he has shared with me that they have got a better results when the artificial insemination is done as soon as the estrus is observed, because many times by the time you observe the estrus, few hours have already passed. So we do not know exactly starting time of estrus. So as soon as you observe the estrus, insemination can be done, and he shared with me that they had very good, better conception rates when the insemination was done as soon as the estrus was observed. So these are the AI equipments. You can see the speculum here. This is the metal speculum, which is used for visualizing the cervix. Now, this is the frozen semen, of course. Everybody knows that. So light source, you can use external light source once you insert the speculum, and to visualize the cervix, you can use the external light source. You can fit the light source to the speculum also. There are some speculums which are available with the light source. This particular metal speculum is not available, does not have a light source. You have to use an external light source. You can use a light which is used by human doctors for visualization of, which is put on the head to look into the speculum. Lubricant used for insertion of speculum should be non-spermicidal. KY jelly can be used commonly. Now, this is, you can see the fixing of cervix here. I have some more pictures, fixing of cervix. And this is how you put the gun. This is preloaded gun with the straw which is thawed, and artificial insemination is done by inserting the gun into os cervix and slightly rotating it to advance it into the cervix. So when you push the speculum against the external os of the cervix, you can fix the cervix very easily and then insert the gun. That makes it easy. The speculum tip can fix the cervix. And also, while pushing the semen sample, the plunger should be pushed slightly slowly, because if the gun is in the cervix only, there can be some slight resistance. So if you push the cervix, push the plunger too quickly or too fast, the backflow of semen is possible. So to avoid that, push the plunger little slowly. So this is another picture of AI. Now this is the another vaginoscope which we have tried, which is made up of acrylic material, and it has a own light source, you can see here. So this illumination is by cold light. You can see this illuminates the speculum, and through this we pass the AI gun. Or if we are using the liquid semen, we pass either plain AI sheath, or sometimes we have a glass pipette, special glass pipette with a slightly bent tip to pass the cervix into the, in case of goats. So this is how the external os of the cervix is visualized to this particular vaginoscope which we have. It's very beautifully you can see. Then we have also tried a hysteroscopy, a telescope with a light source. It's like a laparoscopic hysteroscope. This is a sheath, outer sheath, through which the hysteroscope is passed. And through this hysteroscope, there's a channel here. This sheath covers this particular hysteroscope, and through this channel, we pass this ureter catheter. And this ureter catheter is directed inside the cervix by this particular outer sheath, has a deflector, which pushes the cervix upward or fixes the cervix upward. And then we pass this particular ureter catheter inside the cervix. The same technique is used even in canines. So this technique we tried in case of goats. This is the beautiful picture how the ureter catheter is passing the external os of the cervix. This ureter catheter has a skillet inside, which allows the catheter to pass inside the cervix very easily. And before insemination, the semen is instilled inside. We remove this stylet, attach a syringe, and thawed semen is inserted inside through a syringe. So this is another picture of artificial insemination. Now, laparoscopic technique of intrauterine insemination has also been described. I don't have any experience in this, but just as a one part, it is available. So I put the picture. The next technology which I have enlisted here is reproductive ultrasonography in goats. Now, uses in goats is pregnancy detection is very important, early pregnancy detection, because if you use early pregnancy detection, you know which does are not pregnant and you can induce them in cycle by again using a synchronization protocol. It also helps us in determining the fetal number. So once you know the fetal number, you can manage the feeding. For example, we are feeding the same amount of feed if it is a single tone, twin or triplet. So you can avoid that. You can segregate the herd accordingly and feed accordingly so that you save on the cost of feeding animals, those which are having less number of kids. And the kids which come out also will be much healthier because triplets will require more feeding. Then also you can visualize the ovaries using ultrasound. When you're visualizing the ovaries using ultrasound, you can take the call on the synchronization protocol which you want to use. If there is a corpus luteum, you can go for prostaglandin protocol. If there is a no corpus luteum, you can use the progesterone implants. So accordingly, you can decide your which type of protocol you want to use. There are two types of ultrasonographic techniques used. One is transcutaneous and one is transrectal. Transcutaneous sector probe are used, sector convex, and transrectal we use a linear probe. The frequency used is 3.5 for transabdominal, and for transrectal you use higher frequency, that is 7 to 8 megahertz. So restraint of goats many times just for simple pregnancy diagnosis, no specific restraint is required. You can visualize the uterus in any recumbency. Lateral, we use usually standing also. The goat can be held in the standing position, though we lift one side of the one leg, and from that side near mammary gland, no specific shaving is required. You just put a lubricant gel and visualize the uterus. But this is only for pregnancy diagnosis, which can be very quick. Not so for ovarian, you might have to use more restraint. You have to the better visualization is done by transrectal when you are looking at the ovary, where some amount of restraint will be required. So this is transcutaneous. So when you are passing a beam of the probe, it has to be uh, directed backward because uterus is towards the pelvic side. So your beam of ultrasound should be pointing backward when you are using the transcutaneous ultrasonography. And transrectal ultrasound, a stiffened the transrectal probe is used. You have to remove the dung, clean the rectum and then introduce the transrectal probe. This gives much better visualization because uterus is in direct contact. There is nothing in between. So when you're doing a transcutaneous ultrasound, many times the gas in the intestine can interfere into visualization. So usually what we do is do not do the ultrasound before the animal is left for grazing. So that time the less amount of gas is there, rumen is less impacted. So you are able to visualize even early pregnancy much easily. So this is a non-pregnant uterus. You can just see it cranial to the urinary bladder. This is a sector probe. This is how it will look into transrectal probe, linear probe. In transrectal linear probe, you see the uterus going forward, downward, and a backward in a round shape. This is non-pregnant uterus. Now, when in pregnancy, uterus gets filled with amniotic and allantoic fluid, the contrast seen is much better, and you are able to see the uh, visualize the uterus much easily. Now, for ovarian structure, follicles and corpus luteum, they will produce the echo patterns which are similar to cattle. So you need transrectal ultrasonography, gives you much better visualization of ovaries and its structures than the transcutaneous. So these are the pictures. I have taken few pictures from Dr. Mai only. You can see the ovary here with the follicles here, urinary bladder and uterus. These are again few pictures of ovaries. Again, these few pictures of ovaries. So once you see the ovary, depending on the corpus luteum, whether there is a corpus luteum or follicle, see you can see here, there is a follicle here, which is anechoic, but hypoechoic corpus luteum. So depending on the whether it is corpus luteum or is present or not, you can take your decision which synchronization protocol you want to use or which protocol you want to use for synchronization, whether you want to use PJ for progesterone. Now let's go into early pregnancy diagnosis. In early pregnancy diagnosis from around day, this is picture around day 20, where no M20, 21 days, when you don't see embryo. There is a typical pseudo compartmentalization here. So there is pseudo compartment formation here because the uterus is going forward, downward, and backward. When the fluid accumulates in the uterus, there is no embryo, but the accumulated fluid gives appearance of multiple compartments. They are not really multiple pregnancies or multiple embryos, but it is pseudo compartmental appearance, just cranial to bladder. Now, this is 25 to 30 days pregnancy. The embryo becomes very, very easily visible. Here, you can take a length of embryo, which is known as crown to rump CRL. The anechoic fluid is surrounding the embryo, so you are able to visualize embryo very easily. You can see a flickering heartbeat also within this embryo to indicate that this embryo is alive. Now this is 30 to 40 days. This is around 34 days pregnancy. You can see a head and body part separating now. Early mineralization specks are seen. Around day 40, the mineralization is very prominent. So I will, here you are still able to take the crown to rump length. See, this length is, this is 4 weeks, 6 days pregnancy. 28 plus 6, so 34, 35 days pregnancy. Now 40 days plus, the mineralization is much more rapidly happening at this time. You are able to visualize the body parts much easily. You can see your head of the fetus. This is limbs of the fetus. Here now you are not able to calculate, measure the crown to rump length easily because fetus is not exactly straight, in straight line. So we start measuring the head diameter here or biparietal diameter and use it into various formulas for measuring the days of pregnancy. So day 40 day onwards, we are able to visualize the bony structures very easily. This is the chest of the fetus, head. These are twins are very easily visualized. And from day 40 onwards till day 100, you can continue taking head diameter. Then we start taking the measure. This is again day 40 onwards. You can see head of the fetus very easily. Eyeballs, this is the spine. This is kidneys of the fetus are visualized. We start taking the biparietal diameter of the fetus and put it into formula for measuring the gestational length. Then placentomes are also visible from day 60 onwards, day 40 onwards, you can visualize the placentomes very easily. They are C-shaped. Now, these C-shaped placentomes, they are there because of the concave nature of placentome. In case of goats, the placentomes are concave when they are in the cross section, and when you look from the top, they look like a donut or a flat button. So the measurement of placentomes close to the fetus is taken and put into formula, but somehow I have not found a good correlation with gestational age using the placentome. Beyond day 100, the pregnancy can be easily seen, but it is difficult to count the numbers, and fetuses are too large. They even sometimes the head diameter measurements can become difficult as the gestational days advance. So when you are talking about accuracy of pregnancy diagnosis in a large flock, when we want to scan multiple animals at same time, like say 100 animals at same time. So there has to be speed and reliability at the same time. Though you can diagnose the pregnancy very early from day 20 to 25, 30, so is very easy. Uh, but when we are talking about large flock, where we are talking about speed also, 30 plus 35 days around gestation is the best because it is very easy. Just put a probe and in 30 seconds you are done with, animal is pregnant. Even you can see the number also pretty easily. You can count the number very easily. So for a large flock, personally, I feel 35 days, 35 to 40 days is best because you just spend a minute on each goat, yeah, female doe, and just separate them according to pregnant, non-pregnant, multiple fetuses, single fetuses. So it becomes much easier. Now when we are talking about uterine pathology, we all are aware that there is pseudo pregnancy in case of goats. Many times the owners will come with a complaint that animal looked pregnant, and suddenly the vaginal discharge has come, lot of discharge, and the animal has started milking. And this is also known as cloudburst, and this is hydrometra or mucometra. Many times we see these animals come for pregnancy diagnosis, these does, and we don't see placentome or fetus, and only fluid accumulation that indicates they are having either hydrometra or mucometra. So this is how the pictures will be, hydrometra or mucometra. This is also another picture of hydrometra or mucometra. Just let me just briefly talk about embryo transfer. I will not go in detail at all because it's not for the field use. So in embryo transfer, as everybody is aware, we take advantage of high quality genetic material from dam as well as from sire. There is rapidly introduction of new genetic lines, and entirely new breed can be formed into your existing herd by using embryo transfer. Then this is a part of intensive reproductive management, and for which excellent record keeping is also required. In addition, careful analysis of cost benefit ratio must be considered before an embryo transfer program is started in any flock. Kids which have a high marketable value or a high genetic value will only balance the cost associated with embryo transfer program. So right now, this particular technique is really not for a mass scale application on the field level. So as everybody is aware, there is superovulation of a donor. Then you do artificial insemination using the semen of valuable sire, and embryos are collected and transferred to less valuable recipient. This is a standard protocol for any embryo transfer, let it be cow, buffalo, or sheep goat. So embryo transfer in goats is not like large animal where you do flushing through uh, trans vaginally. where in goats, either laparotomy uh, through abdominal surgery or laparoscopy, embryo recovery is done, and even the transfer is done by in recipient through laparoscopy or laparotomy. In India, it is still limited to certain institutes, and cost involved are very high, and it is less practical for field utility as far as I think. So this is a simple example or a schedule of embryo transfer where you synchronize the recipient and donor and collect the embryos 1 week on day 11 and transfer the embryos on day 11 in recipient. So this is a standard protocol which is available. So I will usually embryos are produced between 0 to 18 embryos are produced per donor after superovulation, and with an average of 4 to 6 embryos. So at least 3 to 4 donors are synchronized at the same time for embryo transfer section, because some donors may produce no embryos, like 0 embryos. So you have to have multiple donors per EP section. Then recipient females are synchronized with the donor. Estrus is identified on day 1 to know their exact starting of cycle, to have an exact day of transfer, which is synchronized with the donor. So 1 to 3 embryos are transferred for recipient by either laparotomy or laparoscopy, and you must have at least 3 to 4 recipients per synchronized donor per donor dose scheduled for embryo transfer. The extra embryos, if produced and you do not have sufficient recipient, you can freeze them and store them for future transfer. This is a standard practices for embryo transfer. So in conclusion, for reproductive technologies, what I can say, reproductive technologies are still not extensively practiced by veterinarians at field level. The main constraint is a farmer's awareness, availability of various equipments and material, trained people to use these technologies, and cost of material which is involved in these technologies. The main 3 technologies, that is estrus synchronization, artificial insemination, ultrasonography, are complementary with each other. For example, when we tried to implement these 3 technologies in a flock which was of 300 does, we had to first use ultrasound to identify, because there was no data, no recording. The male bucks were free with the full flock of 300. So we use initially we did ultrasound in all does, identified the does which were pregnant, separated them, segregated the male and non-pregnant does. We repeated the ultrasound after 21 days just to confirm that we have not missed any does which were previously pregnant but were falsely diagnosed as non-pregnant. Because see, we did a random ultrasound on day 1 where the records were not available. So some does might have been impregnated by natural service below 20 days, which will not be visualized by our ultrasound. So after 21 days, naturally, they will be visualized. So again, we repeated ultrasound. This time, since male was not present in the flock, we were very sure whatever segregation has happened, now these does are non-pregnant. Then we inserted the implant, progesterone, withdrawn the, synchronized the estrus, carried out the artificial insemination. So these 3 technologies go complementary with each other and can be used effectively at the field level if we have enough facilities available. So their combined use is likely to benefit small marginal farmers who are still practicing old methods in goat rearing. For more extensive use of these technology, uh, there is need to percolate these technologies by lab to land transfer, by making people aware, the farmers aware of these technologies, and training more number of persons who can practice these technologies at field level. So thank you very much.